This is Gwen Carden, back again with Rehana Webster of Perth, Australia, who is an EFT Master. Hello, Rehana.
Hello, Gwen. How are you doing?
Great. Good to see you back again.
Thank you.
We were talking last time about what pattern interrupts are and how they relate to curing addictions, treating addictions, and I know that you've worked in the prison system and you've had some really interesting situations where you have actually helped people overcome their addictions, and I was wondering if you'd like to talk a little bit about some of the cases as well as maybe what their patterns were and their pattern interrupt process was.
Certainly, Gwen. I've dealt with dozens of people with addictions in the prison system, and what I'd like to share with you is that each one was using drugs or alcohol to get away from the negative feelings and the negative events that occurred to them in childhood. So this was mostly about childhood abuse. I'm talking about men here now, and I took records and stats of the people I worked with. 95% of the men had been sexually abused, and one of their coping mechanisms was to either drink and at a very early age, and then to take drugs to get away from the horrible events that occurred to them. So it became a habit, it became an addiction, and anytime that they felt threatened, they would drink or do drugs, and of course it became a habit. Now, the pattern was that any negativity in the environment would bring up anxiety, and they would self-medicate. What I did with each and every one of them was work on the core experience. In this case, it would be the sexual abuse. And once we had tapped on the core experience, it would uncouple the negative feelings from the event, and these men would feel so much better, as if they had put the past to rest. And one of the remarks one of the guys made to me, who was long-term substance abuser, was, "Can you see why I turned to drugs? I needed to get away from my mind and my feelings, but of course you can never get away from yourself." And he said, "This is the first time I've been able to look at that event without having the emotional impact that I normally would have. It's like a story that's just been put to bed." So that's how wonderful EFT is, of course, in the hands of a good practitioner, somebody who's seasoned, who can deal with these kinds of problems. EFT is a wonderful tool.
Well, people can sometimes spend years on a therapist's couch trying to get to a core issue and then deal with the core issue. So how is it that this works so much faster? I don't know that anybody ever spends years trying to get EFT to benefit them.
That's right. Well, Gwen, core issues are not difficult to get to, especially when you know how to deal with people and ask the right questions. It's about questioning. Ask the right question. And usually with EFT, you use the feeling that is in the body to take the person back to the core issue. You just ask them, if they're having a negative feeling, just before they, let's say, have a drink or do drugs, you ask them, well, what does this remind you of? When did this happen before? What was the first time you ever felt this feeling? So, of course, it's usually to do with an event, a negative event. And you can take the person back, and it's really quick. Yes, some people spend ages on the therapist's couch trying to get to core issues. However, it is not difficult when the practitioner knows how to take a person back into their core issue. And of course the person usually knows what the core issue is as well. It might be masked, it might be hidden, but it's there, and they usually are aware of it.
Well, I can imagine someone saying, well, I have a drink every time my wife nags at me, and that's really not a core issue, but I don't know that people know themselves well enough to understand that the difference between an event and a real core issue that it's triggering.
Exactly. So that's where a practitioner comes in very handy, because a practitioner can stand on the outside, look in, and suggest to people, what does that remind you of? If you go back into your childhood, did you have certain events that would trigger the same feeling, or with your family of origin, with your caregivers? And usually a person can find and locate what the core issue is.
Very good. Well, we're just about out of time. I want to tell everybody that we'll be having another great interview with Rehana. So I hope that everybody will return on a regular basis to our website, not only to look for the new video postings, but also to look for all the great information that we will be having up on the site on a regular basis. If you enjoyed this video, we ask you to please push the like button down there on the left side of your screen, and we will look forward to seeing you next time. Rehana, as always, thank you. It was very enlightening. Appreciate your time, and we will see you soon.
Thank you, Gwen. Thank you for your time.
Bye-bye.
Bye.